Good evening, and thank you for joining us once again for our Blaine County COVID-19 virtual town hall tonight. I am Mandy Pomeroy, the Administrative Services Manager for Blaine County, and I will be facilitating tonight's event. It's a little hard to believe that last month marked the 1-year anniversary, if you will, that we've been at this COVID-19 marathon, as I have heard some people call it. Again, we want to express our gratitude to everyone for your continued efforts to minimize the spread of the virus in our communities. Also, now that the COVID-19 vaccine is available to anyone 16 years or older who lives or works in Idaho, more and more people are getting vaccinated each day. Still, as we continue to see positive cases, and now the variant strains have been detected here in Blaine County, now more than ever, we need to remain vigilant. Despite our great desire by all of us, it seems, to have some sense of normalcy return. The focus of tonight's presentation will be regarding the COVID stats research project currently underway here in Blaine County. This recently launched study was designed to help understand the prevalence of the COVID-19 virus right here locally. Tonight, we've gathered the dedicated medical and research professionals who have designed and are running this project to provide us all with information on the study, an update on our local COVID-19 situation, as well as updates on the vaccination progress. Our panelists for tonight's session are Jacob Greenberg, Blaine County Commissioner, Dr. Terry O'Connor, St. Luke's Wood River Emergency Medicine Physician and Blaine County Ambulance District Medical Director, and he's also the study's principal investigator. Dr. Tom Archie, St. Luke's Wood River and study co-investigator. And then also joining us tonight are Ben Shepard and Emma Hampson, the research coordinators on this project. Everyone watching can submit a question to the panelists via the chat feature in the GoToWebinar platform. Simply type in your question and submit it, and we will try to get to as many of those questions as possible. I am now going to turn the time over to our panelists, starting with Commissioner Greenberg. Thank you for joining us.
Thank you, Mandy, and thanks to everyone who's watching. I just want to share some statistics with you, and then I'll turn it over to Dr. O'Connor and Dr. Archie and his team to give you more about the study. In the last 7 days, we've had 26 positive cases, whereas in March we had, through the whole month of March, about 108. The average prevalence rates right now in April is 12.3. In March, it was 15.1. So we saw a little bit of a downtick there. It's kind of wavering a little bit like a roller coaster. You know, yesterday we saw 9 positive cases, but before that, you know, we're seeing a lower number of cases. So everybody, you're doing a great job. Let's keep it up and make sure we get vaccinated before, you know, we see a surge again. Just stay the course, wear the masks, do the hygiene. The week ending 3/27, we had a 8.58% positivity rate, and that's pretty high. We want to try to get that down below 5%. We didn't have any deaths in April or March. Cumulatively, we've had 17 so far in Blaine County. Our vaccination rate, I think, is the highest in the state, if not in the nation. 58.28% of our population has received at least 1 shot, and 6,917 are fully vaccinated. That's really terrific, and you know, what a great job to our providers who are supplying the shots, and to the community for stepping up and getting vaccinated. I think this is really going to help us come out of this more quickly. So great job, everyone. Just want to make sure you understand that we still have a mask mandate, we still have social distancing in place, and we still want you to, you know, take care of hygiene so that we keep each other safe. With that, I'm going to turn it over to Dr. Archie to talk to you about this study. Dr. O'Connor. Dr. O'Connor?
We can go either way. I'll start with just some context for everybody. Again, to echo the words of Commissioner Greenberg, thanks again for everybody's engagement, involvement, and stewardship with the pandemic in the last year. Certainly, we've all navigated through this together, and we are so close to the end, I hope. And I certainly am seeing the finish line come into view closer and closer every day, and it's great news. This particular research project, to put it in context to our response to the pandemic dating back all the way to 2020, has been one of many arms of response to the pandemic to try to effectively mitigate the effects and positively respond in a meaningful way to navigate through this problem, and perhaps help educate not only ourselves but others around the country and the world with how a community can respond to the pandemic, and also learn from the cases that knock on the hospital's door. This was initially evolved and came together months and months ago with a consortium of other researchers who aren't present here, including the Fred Hutch Cancer Research Center, vaccine scientists there, and also La Jolla Institute and partners at the NIH, and with the support of the St. Luke's Wood River Foundation. Initially, it developed this to amplify our testing capacity, and subsequently led into partnerships to actually look at some big unknowns, and that is the intricacies of your body's immune response as it's exposed to this virus, and how that inner working and machinery leads to you even getting symptoms of illness, how severe you get ill, and perhaps whether you might be able to transmit the disease to other people even if you are asymptomatic. So it has been a very long process, I will say, but it's been a very interesting one to engage with these scientists who are some of the leaders in the field in the world. And the good news is we did put together a project and had great support financially with partners. The only bad news, which really is good news, is that by the time we were ready to roll out, vaccines were here in Blaine County. And the initial role and goal of the study was to investigate people while they were still at risk of contracting the disease and before they get vaccinated. The main reason we wanted to call this meeting is I think there has been some confusion. Well, one, there's been an amazing amount of enthusiasm behind this project. Our little county, relative to the larger urban centers that are also involved in this project on the West Coast in California and in Washington, has gathered more interest and engagement than any of those other sites. And I would say thank you for that. Thank you for wanting to participate and be part of answering some of these questions. And it really, frankly, it's really value added to me to be proud of this community and want to continue and be a proud citizen of just being in this county. That being said, as many of you who have been interested have gotten access to the vaccine, we've had to unfortunately stall or decline your offers for enrollment, because our initial goals were to access people prior to obtaining a vaccine. And I will also say I'm sorry if there's been some confusion for some of those enthusiastic individuals out there that we've called and took you off the list because you were scheduled to get a vaccine. That was on me. That was a personal call with how rapid the rollout of the vaccines have been, and we've decided to make space to prioritize other people who weren't scheduled yet. I think we are now appreciating as a research team that we are overall excited. I mean, how quickly people are getting vaccinated. That's clearly what's in the best interests of the health of this county. But there are still opportunities, and we just wanted to clear up that there are still opportunities. We're still happy to engage with interested individuals that want to enroll in this research project. And the bottom line we want to convey is, even if you are scheduled, even if you are planning on getting a vaccine, we would love to hear from you. And myself and Dr. Archie and our team may highlight what would be involved and what you can contribute and engage in this research, even if you do get vaccinated. But the key question really is to help us understand the inner workings and mechanisms of your body's response after you get the vaccine, and also be part of a body of evidence to prove that you can't carry or transmit this disease, hopefully ever again after you get vaccinated. So I'm going to hand this off to my partner and other co-principal investigator, Dr. Tom Archie, to talk a little bit through some of the frequently asked questions, a little bit more overview, fill in the pieces I might have missed. And then we'd be happy to take some questions. And if I don't get any clear ones, then I may touch base with Emma and Ben about some other kind of frequent misconceptions or confusion that's happened so far in the rollout. Tom.
Yeah, thanks, Jerry. So I want to talk about some frequently asked questions in a few minutes. And before I do that, I want to talk about some evidence we have just recently on variants in the Valley is kind of interesting news. So for the last 5 or 6 months, I've been serving, alongside working on Blaine COVID stats, I've been serving as the director of COVID outreach Wood River in collaboration with the St. Luke's Wood River Foundation, which has been funding the testing project. And starting midwinter, this couple months ago, we started an exciting project by creating essentially the first Blaine County search for coronavirus variants. And what we did was we started sending all of our PCR positive samples to the University of Washington Fred Hutch Virology Lab to contribute in the larger national research, and certainly for Blaine County's interest and Idaho's interest, search for coronavirus variants. And what part of what was fueling that, a big part of what was fueling that, was back in January, we had a very rapid escalation in the rates of new infections, a rate that we hadn't really seen since last March when the pandemic began here locally for us. And we, several of us physicians, were pretty sure there were at least one of the new variants that we'd heard a lot about here, and that got us interested. So about a week ago or so, we got our results back on the first batch, covering the month of February and the first week of March. And what we found was, of all COVID Outreach Wood River's positive viral samples, 2/3 of them were variants of concern. And of those, of the total, 51% were the California variant, and 16% were the UK or United Kingdom variant. And the significance of that is that, for one, both of those variants come with an increased rate of transmission and infectiousness. It just makes it easier for people to spread and this virus in the community really rapidly. And specifically to them, in the case of the UK variant, it actually produces a disease that is more intense and leads to more illness and greater rates of hospitalizations and death. And in the case of the California variant, it is associated with a little bit greater chance of actually getting sick with COVID-19 after having had vaccination a month or two earlier. Most people get vaccinated or protected against it, but we do see some come through. And I've seen a case of that, and it was a pretty mild disease. So the vaccine works, but in some of the cases of the variants, there is some vulnerability there. Now, for the big picture, for the 30,000-foot view, having mutation variants in viruses is not a surprise. And in fact, in February, a study was published reporting that in the whole pandemic, from the beginning of from January of 2020 through midwinter, in the United States alone, scientists have observed over 7,000 mutations to the coronavirus in some 13,000 strains. And so and most of those aren't all that significant. They can happen anywhere in the genome, but only when some of the mutations happen in the genome that codes for some of the important structure of the virus, in particular the spike protein, that can change how sick it makes people and give it some potential advantage in terms of evading vaccination. So how that plays a role here in Blaine COVID stats is that, for one, we're going to be sending all of our positive samples for variant sequencing. So it allows us to continue that effort to contribute to the local scientific knowledge about the presence of variants here. It allows us to make decisions, or allows decisions to be made regarding when it's appropriate to relax masking and distancing regulations or recommendations, and also when to double down on them when we're starting to see a real uptick in cases. And it also guides vaccine decision making at the national level. So the reason we know all this about variants and other aspects of the coronavirus is that scientists around the world and a huge number of communities are doing all kinds of work on the pandemic and contributing to this body of literature, to which we want to contribute some valuable information using Blaine COVID stats as a platform. And this study it's well designed. It's really important for Blaine County. It gives us some protection You can do home tests that you send out to us, and we send it to the lab once a week for folks that are participating. If folks are participating in that and they have a household member that wants to participate, they can be doing this intermittently as well. Participants get paid for being part of the study, depending on how much work they're doing. If they're doing swabbing every week and questionnaires every week and they're in that group, then they're going to get paid more than folks that are doing a swab only, they get symptomatic. And these are all designed by study protocol. The protocol that we created, part of what took a while and what's been really interesting and rewarding about this is that it caught the eye of researchers at the National Institutes of Health, and now our study is funded in part by the St. Luke's Wood River Foundation and by the National Institutes of Health. And so as people participate in the study, their labs will be run at the La Jolla Center for Immunology, studying things like, well, a whole bunch of parameters in the immune system, T cell activity and antibody responses. Our nasal swab PCRs, they're comfortable, they're not painful. We teach you how to do it at home. Those are being run in Seattle at a lab there. St. Luke's is our host, but all the information for folks is held in a secure database that's separate from St. Luke's, and there is really a great opportunity here. Because it rolled out during vaccination time, you know, our pool of folks that could actually be interested and want to participate is really dwindling, because it's intended to be a study that in which we draw immune parameter labs and then begin to monitor for coronavirus infections. And so we need folks that haven't been vaccinated yet. So if you are somebody or know somebody who feels called to participate in a study like this, who hasn't been vaccinated yet, then if they want to join and get started, they can get vaccinated later in the study, even right after getting started. But as long as we have a snapshot of what their immune function's like before we actually administer a vaccine, that's really valuable in this study. Now, for some folks that either can't or are uncomfortable getting a vaccine, or for whatever reason don't plan to, or this is an opportunity for them to be doing this this testing on themselves once a week, and protecting their households and their workplaces by giving them an earlier indication, if they actually were to become infected with the coronavirus, that it's present. And so it's an opportunity to be protective of other people too. So we're really excited about the opportunity to work with a lot of you and to contribute to the scientific literature on how our immune system responds to the coronavirus.
Great. Thank you both, Dr. O'Connor and Dr. Archie. I think it's safe to say that we are in very good, capable, professional research medical hands. So it's very exciting to hear that information. I don't have any questions that have come in from the audience and the participants. So if you do have a question, please feel free to send it in through the chat feature on the GoToWebinar platform. Do you have any specific details on the project that Ben and Emma can contribute as far as an educational and outreach perspective?
Yeah, sure. Maybe Emma, I'll start with you, since you're kind of our chief engagement officer, so to speak, and Emma will be the voice that you'll hear if you are interested in enrolling in this project, and we'll give you a phone call and follow up about the details of the project and getting you enrolled. And I think there have been, Emma has been very flexible and diligent in kind of flipping some messaging around and making sure to keep people engaged and letting them know if they're eligible. Emma, can you just highlight again who you'd love to hear back from that maybe that hasn't returned your call, that was initially interested, just to make sure we're not missing anybody, and anything else you want to add as far as kind of common misperceptions or questions that you've gotten in engagement so far with participants.
Yeah, definitely. So I think both Tom and Terry hit the nail on the head with the fact that we are now enrolling individuals that have upcoming vaccine appointments, and we would love to get you in before that appointment and enroll you in the study. I think the other question that I encounter most frequently, we have a question on our screener that asks if you will be traveling, or it asks if you plan to stay local for the next 6 to 8 months, because your enrollment in the study takes place over that period of time. If you are planning to travel, that is absolutely okay. We would still love to hear from you. And so you can click no on that question on the screener. That's probably the other question that screens people out frequently. And then, I'm sorry, can you guys hear me? It says I'm having some network. Okay, good.
Okay.
So yeah, that's what I experienced most. And then Ben, I don't know if you have anything else to add that we've seen that may have screened some folks out, or just other things that we should add about who we can include in the study.
I mean, I think if anything, I would mostly just really reiterate what Tom had just said, and that is that, you know, if you're not vaccinated yet, even if you're going to be vaccinated very soon, we would love to have you in the study. And really all that we need to do before your vaccination appointment would be to get that sort of immunological snapshot. I like the way that Dr. Archie described that, which really sets what it is a baseline so that we can compare any later results that we get from you, so that we can really wrap our heads around what's changing in response to the vaccine, in response to the virus, and potentially over time. So yes, please sign up, even if you have a upcoming appointment, and we will try and get you in as soon as we can, hopefully before that appointment, so that this works out.
Absolutely.
Can somebody let the audience know where they might go to sign up for this study?
Sure. The website is called BlaineCovidStats.com. BlaineCovidStats.com. You can sign up there.
Great, thank you. We did have one question come in that I think is pertinent to the discussion we've had going on. How many participants in Blaine County have enrolled in the study? And then how many additional participants are you looking for locally? Is there any one of you that would be eager to take that question?
I can go ahead and respond to that. I believe I just, last time I looked at the database this afternoon, we had 21 people who were officially in the study in terms of their consenting paperwork. It is a research study, so it's very important that we have research consents, and that's part of our enrollment process. And once that form is signed, that was when we consider people to be enrolled, and currently the number is at 21. We are hoping for much more, and we are budgeted for significantly more if we can find those folks before they get vaccinated.
Great, thank you. How about anyone who tested positive for the virus last year? So say during our big peak in last March and April, is there anything that prohibits them from participating? I'll throw that to you, Dr. Archie.
Sure. Yeah. So yeah, in addition to being vaccinated, having been vaccinated, having had COVID-19 already also excludes people from the study. We're looking to study folks who have not had the infection that we know of and that have not been vaccinated yet.
Okay, great. Thank you for that. How about, here's an interesting question. What sort of findings do you hope to see with people who get vaccinated later on? And what sort of changes do you hope or anticipate to see in the immune system? Either Dr. Archie or Dr. O'Connor for that.
Yeah, it's a great question, and I think everybody's is trying to figure it out. I think there's some expectation of what we hope we'll see, but I think to not belabor the details and get too complicated, you know, we clearly have evidence that the vaccines work pretty well for an endpoint of you getting sick or having to be hospitalized, right? What we don't know is exactly what's happening in your body that makes that work, and we also don't know how long that's going to last. Right now, we're getting more information that it sounds like it's probably going to last 6 months. We'd love to get information that it lasts much longer than that, and maybe it's just a one-time vaccine and you're done. Also, in addition to that, what you need to have spinning in your immune system, so to speak, to keep you from not only getting sick, but potentially from being an asymptomatic carrier of this disease is still unknown. And that may also help highlight some of the inner mechanisms that we're seeing in the response to you either getting sick with COVID-19, we hope not, or the response of you getting a vaccine will help inform those mechanisms and also help validate which vaccines are the most effective and what people want going into the future. If one rises to the top of actually being the best as far as the most durable, most effective, most likely to prevent you from giving somebody else an infection. On top of all that, since we will be following you, if we enroll you before you get your vaccine, and we're following you through the time you get your vaccine, we still would love to get the information of you doing a weekly swab or reporting to us if you might be getting sick, in the odd chance, but unlikely chance, that you might still be possible to carry this after you get vaccinated. I think most scientists agree that the probability of that is quite low, but also the latest evidence that we have right now tells us that it's not zero, though, and it's still possible. And this really has the opportunity to help us identify that. And then there's just the risk of, how much risk is there amongst, family units, people who are in close contact with one another. That's always been a big area of concern of ours. Clearly, most of the spread in Blaine County has been within households after it comes in from one setting or another. We hope most people within households all are going to get access to a vaccine soon, but as Dr. Archie had mentioned, there may be other obstructions to individuals or family members getting access to a vaccine. You might work in an industry where you're somewhat high risk and constantly exposed to other individuals in a setting where masks can't be worn, like a restaurant, while your patrons are eating, and you're worrying about the risk of bringing that home to somebody else. This study offers an opportunity to provide some surveillance within the household as well. So I think I'm curious to know, and I really do hope we get some information about what happens in the inner workings of our immune system with this vaccine. I'm hopeful that it will only continue to support the outcome measures we have so far. That is, you're not going to have to go to the hospital. You're not going to be hospitalized with severe illness. And also, I'll add one thing else. We don't know why some people are getting, chronic conditions from this disease process. Even if you have very mild symptoms, even if you're not hospitalized, both Dr. Archie and I know, and anybody who's been looking at the literature and the research, and I'm sure many of you in the community have friends at this point who are still dealing with issues from a COVID infection months and months ago. We're not sure why that's happening, but how your body responds to being exposed to the virus or being exposed to the vaccine might help inform that big question as well, which unfortunately in my mind, I think may turn out to be a huge story in the aftermath of 2020 as it relates to COVID-19. So I hope that answers that question so far. I'll also add, I think, there was a lot of interest when we initially rolled this out before. I would think, and part of me hopes, that we lost a lot of people because they actually got a vaccine much earlier than they expected. But if you may have been, or someone who initially engaged and reached out and wanted to engage in this vaccine, or sorry, in this research project, but hasn't actually gotten their vaccine yet, but this might be scheduled in the next week, now is the time for us to know, like as soon as possible. We still would love your help. There's still so much that you can do to help us out going forward. So we'd love to hear from you. And if you know anybody else that's heard about this research project, or if you yourself were interested and thought you wouldn't qualify because you eventually want to get vaccinated, that is certainly not the case. And we want to know and hear from you as soon as possible too. And that's why we called together this quick meeting tonight.
Great, thank you. Another question's come in. Can you share or shed any light on any differences between the two vaccines, the main ones, which has the multiple doses, so the Moderna and the Pfizer, and then even the single dose of Johnson and Johnson, as their susceptibility to the variant strains?
Do you want to start with this one, Tom, and I can follow up?
Yeah, sure. Well, I mean, essentially getting at the last part of the question in terms of variants and vaccination, you know, one of the stories about vaccines and variants came a little bit later. You know, back when the Pfizer and Moderna vaccines were being trialed, we didn't in those populations have particularly large segments of the studies, segments of the people in the studies exposed to the UK variant or the California variant or the South African variant. The Johnson & Johnson vaccine came out later, and some of its population in the studies was in the United States, and some of that group was in South Africa, where the now relatively famous South African variant was found to be a little bit of a problem, in that the Johnson & Johnson vaccine, while being overall preventing essentially 100% of deaths and hospitalizations, was about 70–75% effective in preventing all infections. But in South Africa, where this other variant was circulating, it was down in the upper 50s. Now, there's been some evidence coming out that the Pfizer and the Moderna vaccines both have a little bit of a reduced capacity against the South Africa variant, and possibly the California one as well. But what that really means is that someone could potentially get COVID after having them, but either not be aware of it and be asymptomatic, or have a very mild disease. They still would be protected from really the big problems with this virus, which are this massive inflammation that can happen to some people. Right now, there are some advantages to some of the vaccines depending on the population. For people that really just can only really want to get one vaccine, then the Johnson & Johnson is an easy decision. For kids, you know, now we have 16-year-olds and 17-year-olds who can get vaccinated. They can access the Pfizer vaccine because the other two haven't. The studies on younger people haven't been published yet. So I really feel like if you have an opportunity to get vaccinated, and you don't, you know, we don't really have a say about what's available. In fact, as a vaccine provider, we don't actually know until about a couple days before our supply comes what we're actually going to get. And so we're, you know, really we take what we can get as far as vaccination. I do think that they're all equally valuable in terms of preventing the real problems with coronavirus, which are the big problems where people get hospitalized and get this the cytokine inflammatory storm. And that's really what vaccination is all about. I mean, they're all three really valuable and way more effective than, I mean, influenza vaccine helps reduce hospitalizations too, but these three really far outpace the efficacy of the average flu shot. That is for sure.
Yeah, and that's a great context to put this in. I mean, relative to other vaccines that have been evolved, and certainly at the time frame that this has been evolved, you know, the initial swath of data demonstrates that all of them are remarkably effective. And I think even in the face of the variants, they're still going to be much more effective than a placebo by far. But there are still some questions. I mean, it's a great question that came in, because we still don't know, and we will be asking individuals what vaccine they're getting as part of the research project, because we're kind of curious. Might there be differences that play out in the immunologic mechanisms that get moving in you once you get this vaccine, and might that have an impact on your susceptibility to carrying the disease, the odd chance you might get it again, and those sorts of questions going forward. You know, it's my firm belief that any one of the vaccines right now is great. It's the right thing to do. I think if I had a strong feeling that you should get one vaccine over the other, I would clearly have shared it by now, but I just don't have the evidence to be able to support that. There's no foundation to favor one vaccine over the other beyond the one that you can get in your arm now. I think going forward, there may be more information to be gleaned. We're one of many projects that can help contribute to help understand some of those subtle differences. I think the one thing that's giving us a little pause right now, and again, it's hard to attribute to what it is, but as you know, we are seeing, we're seeing another little mini bump in Blaine County right now. Certainly manageable, but sad nonetheless, because we don't want any more people to get sick that don't have to. But in other states like Michigan, right, there's a big resurgence, and we don't know, is it because of us? Is it because of our human behavior? Or does it have something to do with how many people are using normal precautions before they get vaccinated, wearing a mask? Does it have to do with the fact that not many people in some states compared to others are getting vaccinated enough? Or does it have anything to do with the fact that we're seeing the UK variant become the predominant player and representing the vast majority of new cases of disease, and more so, more and more of the new cases of disease as each of these months march on? We don't know. We'd like to do our part to help answer that question and that curiosity going forward, and that's another thing that this study can help offer to do.
Yeah. And when people get, one of the things we're going to look at is some information, and Dr. O'Connor alluded to this a little bit, on long COVID. So for people in the study who test positive, not only will we be searching for variants in those samples, but also we'll be following up with you by questionnaire for quite a while after you're done collecting samples and drawing blood and all of that, to track along what happens in terms of so-called long COVID. And something else that occurred to me, if we've had 6,000 people in a valley of approximately 20 or 23,000 people, if 6,000 people have been vaccinated already, and about approximately half have either been fully vaccinated or have had one, then that leaves about 10,000 people here that haven't been vaccinated, and some of those are kids, but a lot of them are adults too. And so if what we really need some help getting the word out about the study, because it really can be really useful it can be really helpful for the scientific literature, but can certainly be helpful on a day-to-day basis and a week-to-week basis for people's lives, to just simply be able to test themselves every week. And this testing is, like I said, it's not uncomfortable. It's just in the front of the nose. And what a participant will do is as follows. They'll fill out a questionnaire online. They'll have they'll have a conversation on the phone with Ben or Emma to get consented. They'll come in, they'll have their blood drawn, and then they'll go about their way. And then if there's 4 groups in the study, the group 1 is the one that, if they haven't had COVID yet before, because we'll be able to figure that out with their blood test, and they don't have it right then when we enroll them, which is possible, then they will do this little swab in their nose, in the front of their nose. Again, it's not painful, once a week, and they'll get paid for that. They'll fill out a questionnaire, which takes about 5 minutes once a week, and they'll get paid for that. They'll get paid for the blood draw too. And then along the way, if they get a cold or symptoms and not sure what's going on, then we might ask them to swab their nose a little more frequently for a week or 2, and then go back to baseline. If they turn positive for COVID, they'll have a blood test. So again, we have this snapshot, and then after the infection, and then at the end of the study, everybody will have a blood test one more time, and we'll get a pre and post comparison. So really, it's an opportunity to contribute to science, like I said, but also to be able to protect your families and protect your coworkers, just by being aware of the presence of the coronavirus. So please help us by getting the word out, and we'd love to fill spots. We have funding for as many as 600 people, and we'd love to study as many people as we can within that realm, within that range.
Great, thank you. Starting to see a few more questions come in. Dr. O'Connor, you touched on this a little bit, but how about if a Can you talk a little bit more? Is there any definitive science on if a vaccinated person can be a carrier and infect other people?
Yeah, great question. And I continue to ask this one of myself all the time. You know, right now we need more data on that. There are some research projects undergoing right now that will help answer that question. Some really large scaled ones, most notably multi-university based study looking at the potential to be a carrier, in other words, an unknowing carrier of the virus that may give it to somebody else even after you've been vaccinated. What I'll reiterate from what I said before, I would say the probability is quite low, but also based on preliminary data from the vaccine trials themselves, it's not zero. But in that, how infectious is that virus that someone can still have in their nose, even if they've gotten a vaccination? We don't know. We're not sure. I would think, and common sense would say, right, the probability you're still going to spread it to somebody else after you get vaccinated is exceptionally low. But this is a big question that I'm really personally invested in, because I would love to have evidence to feel confident that I can stop wearing a mask in situations. Particularly, I'm pretty tired of trying to have a meaningful interaction with my patients with a barrier on my face at all times. It's obviously not ideal, but at the current level of evidence we have, it's the safest thing for you and me right now. I'd love for that to change, but you know, I'm not going to move my practice on that until the science demonstrates that it's a safe thing to do. And we're still figuring out. So it's a really important question. It merits being asked over and over again, and I'm really excited when I have the answer to that one.
And it's a question that this study can help answer.
Yeah. Great, thank you.
Great question.
Couple of questions coming in about testing positive a second time. If you've had it again, or if you've tested positive for COVID once, can you get it again? And do you have any data or information on the reinfection rates?
Yeah, another great question. Tom, actually, Tom, I'm going to send this your way, because you follow a regular subset of patients in your practice. I certainly have seen reinfection, sometimes with symptoms as well. I've seen people that have been reinfected asymptomatic after having pretty severe disease and definitely gave it to somebody else in close contact with them. How and why that happens, I still don't know. And I think if, in retrospect and in a magic time machine, I could go back and enroll those people in this research project before they got infected to see what was happening inside their immune system, you know, before they got it the first time, and how that might have related to their risk of getting reinfected and giving it to somebody else. I'd love for that to happen, but you know, the timing just hasn't been as such to look into that. But it's certainly possible. It's a rare occurrence, but it's not so rare that we haven't seen it in little old Blaine County.
Yeah, I agree. I've seen it happen as well. Not a ton of times, but I've seen it, and reiterate what Dr. O'Connor said. It'd be great to study.
So along those lines, is there any information coming out about if the second positive case for these people has been one of the variants?
Another great question, and actually, you know, something that we've been curious about. A lot of the cases, my opportunities in these circumstances have been before we've had access to sequencing to assess if it's a variant. It's certainly suspicious, right? Because it might be a virus of a different flavor that it's evaded your first immune response. But we don't have at least any local data to prove that that's the case yet.
Yeah, I'm aware of just one case of someone who had COVID 5-6 weeks after their second vaccine, but it was the first time that person had been infected, and unfortunate. Well, it's unfortunate that the person got sick, but I think the vaccine helped the person not be terribly sick. But nevertheless, in the context of that, it happened while we were in this process of searching for variants. And so at some point in the next several weeks, I'll have information back about what variant that was. Fortunately, the person's recovered now and is doing well.
Okay. How about anyone testing positive after having received the vaccine? Have you seen any of those cases or concerns about that?
Yeah, that's what I was just mentioning. That's that case I was referring to as someone who tested positive, was sick, isn't now, fortunately, was sick for 10 days or so, and had had the second vaccine 5 or 6 weeks earlier, so was well outside the window, was well vaccinated. And those cases will happen, and it may not even be a variant. It just may be bad luck. These vaccines are not going to prevent 100% of people from getting any coronavirus vaccine, but they're going to prevent real severe outcomes. So yeah, fortunately, we have seen that, not very many times. I've seen it once, and fortunately, I'm going to be able to look and see which variant, if there is one in that case, that turns out to be. But these are great questions, and this is where it's from these questions, or from questions like this, that research projects like this come up and create. So we're
Exactly.
anxious.
I mean, I just see the circumstance playing out. I mean, if some of you who are about to get your shot out there are thinking, well, gosh, I mean, it's still possible I might get sick again or give it to somebody else. I mean, I would reassure you that it's really unlikely you're going to be admitted to the hospital, have a severe case of illness. But boy, if in the unfortunate and unlikely event it does turn out to be you who gets it again after getting the vaccine, what an amazing opportunity for us to understand how and why that happened, and might it be a variant if you're enrolled in this study. I mean, these are the things, these are the circumstances. What you guys are hitting on is exactly as Dr. Archie said, these are the questions we've been batting around in our head, these circumstances that you may be playing out, these hypotheticals in your mind right now. And so that's why we would love, if you're curious about these questions, these are the sorts of things that the project can hope to answer.
Great. And one last one, and then we'll look to wrap it up for the evening. How about those individuals with autoimmune diseases such as ulcerative colitis or rheumatoid arthritis? Any concerns about or risks for those patients in terms of getting the vaccine?
The main, I'll answer that. The main issue with inflammatory autoimmune diseases and vaccination has really been more that a lot of times the people that have those conditions, not everybody, but a lot of people in those conditions are on medications that reduce their immune response to triggers, which is the purpose of being on the medication, so that they don't suffer from ulcerative colitis flares and rheumatoid arthritis flares. So the main downside, if there is one, and I've had several patients that have been through this, is that they have to hold their medications that they find helpful for their arthritis or for their colitis for 2 weeks or so before they get vaccinated, and for typically about a week or so afterwards, so that there's a window of time when they can receive a vaccine and actually mount an immune response, which, by the way, is why people have these symptoms that we all hear about for some people with vaccines. That's the immune response. That's the immune system responding to having been vaccinated. And so that's really more of it's more in the line of a discomfort side of things. It's not a big problem. But as far as the vaccines themselves causing trouble for people that have inflammatory or autoimmune conditions, we just haven't seen that, except for having to stop the medicines for just a little while. Typically, like I said, about 2 weeks before and a week or so after. And frankly, folks that have inflammatory autoimmune conditions that are on medications that suppress their immune response, they're by default more susceptible to bigger infections from any virus or any bacterial infection. And so being vaccinated to protect them from severe COVID infection is actually a really good idea. And that's why those conditions are on these high risk categories. So I'm not concerned about the vaccines hurting them. And I am more concerned about COVID-19 itself hurting them, and I think vaccination is actually appropriate.
Fantastic. Well, thank you for all of the information that you have each provided us this evening. That wraps up the question and answer session for the panel. So I'll turn it back over to you for any last comments. We'll start with you, Commissioner Greenberg.
Last comment. So anybody out there who's interested or know someone who might be interested in this study, please have them contact this group. This is a great opportunity to help the community and the global community at large. So please join if you can. Appreciate it.
Thank you. Dr. O'Connor?
Yeah, thanks, Mandy. No, just thanks for your interest, everybody, and thanks for your questions. Quite insightful, and really attest to why we're doing this. I mean, you guys have the same curiosity as we do. That's why we're here. That's why we're doing it, and it has an added benefit that it provides some extra security for our community as well. So, you know, Dr. Archie and I have been volunteering our time for months because this was, you know, it's a win-win situation for us. And at this point, although we have a little bit of a challenge, it's a good problem to have. People are getting vaccinated, but we just wanted to provide an opportunity that there's still an opportunity out there. So yeah, thanks for showing up, and please spread the word.
Thank you. Dr. Archie, any last comments?
No, I think Terry wrapped it up really nicely. Again, please just spread the word, help us and get the word out to the communities, let them know that this is available for them, particularly for folks that either can't or won't get vaccinated, but want some protection to be aware for themselves and for their families, and for folks again that aren't vaccinated yet, that haven't had COVID-19, but are planning to get online, Blaine COVIDstats.com, and let us know you're interested, and fill out the enrollment questionnaire, and we will call you and get you signed up. We'd love for you to get enrolled and get involved with the study. It's important.
Thank you. And Emma?
It's all been summed up really well by everyone, but absolutely reach out by phone or email if you have any questions, and we are happy to chat with you and tell you more about the study. So thanks so much for everyone's interest and support. We really appreciate it.
Great, thank you. And Ben?
Yeah, I think most things have been summarized a few times now. I guess my one additional comment that I'll make is that, you know, we really would love to get everyone into the study before you're vaccinated, but please do not delay your vaccination so you can be part of the study. We want everyone to get vaccinated.
Great. Thank you each so much for your participation and your time tonight, both the participants out in our virtual town hall land, as well as our panelists. You all have been doing so much hard work and doing the heavy lifting, and we really, really do appreciate your time and your efforts. Thank you to everyone in the community for all of your continued efforts to help minimize the spread of the virus. And hopefully, as Dr. O'Connor mentioned, we're seeing some light at the end of the tunnel. Again, thank you to everyone, and stay safe and go get your vaccine. And if not, then hopefully sign up to participate in the study. So thank you all. Have a good night.
Cool. Thanks, team. Good night.
Good night.
Good night.